Hello, and welcome to the My Heart and Mind podcast, where it's all about creating the feel-good mindset so you can make the most of every moment and reap the benefits of getting the most happiness out of life. And now, over to your host, Sally Crawley.
My show is for you if you've had a heart attack, heart surgery, a cardiac arrest, or your life has been impacted by a cardiac diagnosis. It's all about mastering your thoughts and feelings and emotions so you can feel great and live a life that you love despite your diagnosis. Thank you so much for joining me today. Just before we get into the show though, please be aware that my work is not intended to replace conventional medicine. It is complementary. If you have any concerns about your health or your heart, then do seek medical expert advice immediately. Hello and welcome to my show. I'm Sally, and today we're talking about a topic that's essential for anyone living with angina: vasodilators, especially GTN or glycerol trinitrate, and how they help manage chest pain safely and effectively. In most instances, anyone that has a cardiac diagnosis is likely to be issued with a vasodilator for just-in-case situations. I'm incredibly lucky, and to date I haven't had to use mine, but I always know where it is and that it's in current date. If you or someone you love experiences angina or chest pain, knowing how these medications work, how to take them correctly and what to watch for can make a huge difference in heart health and confidence. So grab a notebook and let's get started. So firstly, what are vasodilators? A category that we're going to look at today is called nitrates. They help improve your oxygen supply to the heart whilst reducing its workload, which can ease chest pain. By relaxing and widening your blood vessels and reducing blood pressure, this can help relieve symptoms. Usually you'll be on a vasodilator long term, sometimes for the rest of your life. There are two types of nitrate medicines: short-acting versus long-acting nitrates. Short-acting nitrate medicines relieve angina symptoms within a few minutes. These are taken as sublingual spray or a tablet, and in some cases as a topical application like a cream for prevention rather than rapid relief. They're absorbed through the lining of your mouth and into your bloodstream. The most common short-acting nitrate medicine is glycerol trinitrate, often called GTN. Then there's the long-acting nitrate medicines preventing angina symptoms. They do not relieve an angina episode within minutes. These are usually tablets that you swallow whole. You do not put them under your tongue like you would a short-acting nitrate. Nitrate medicines may also come as patches, which gradually release the medicine through your skin. Your GTN spray or tablet is a nitrate. Nitrates relax the coronary arteries and allow blood to reach the heart muscle more easily. Always keep your GTN spray or tablet with you in your pocket or your bag. And in some countries, emergency GTN sprays are available from your pharmacist without a prescription. Always read your instructions and check the expiry dates. So what are the common vasodilators? So you might have heard of a few of these, and I will pronounce them rather badly. But here we go. There's isosobide dinitrate, isosobide mononitrate, hydrolanazine, nitroglycerin, and minoxidil. No, minoxidil is more commonly used for severe hypertension more than for angina. So how do you know when to use your short-acting GTN medications? You should use your GTN spray or tablets at the first sign of an angina attack. That's chest pain or discomfort. You can also use it a few minutes before any activity or stressful situation you know is likely to cause angina, such as exercise or climbing the stairs. So the best way to take the GTN tablets is to sit down. Put a tablet under your tongue and close your mouth. Allow the tablet to dissolve slowly. Don't suck it, don't chew it, and don't swallow it. Close the container. This is really important so that your tablets don't lose their strength. Then rest for a while. and when you're ready, stand up slowly. It's a good idea to have a spare unopened bottle of tablets just to make sure you don't run out. So what if you've got a spray? This is how you should be using your spray. Before using the spray for the first time, check it's working by pressing the button on the nozzle a few times until a fine mist comes out. Do a test spray onto a tissue so you know how it works. And again, you sit down, and if you haven't used the spray for over a week, do one spray into the air first. Hold the nozzle in front of your mouth with your finger on the button. Take a deep breath, open your mouth and lift your tongue. Spray under the tongue by pressing once firmly. Do not inhale while spraying. Close your mouth immediately. Breathe through your nose, keeping your mouth closed. Rest for a while before standing up slowly. And just like with the tablets, it's a good idea to have a spare spray just in case to make sure that you don't run out. How do you know when to call 999, 911 or emergency services? If you've taken 2 doses of GTN and you are still in pain 5 minutes after your second dose, or your pain is getting worse, or you feel unwell, call emergency services immediately. These are signs that you may be having a heart attack, and my motto is, if in doubt, check it out. But just for clarity, what is 1 dose? 1 dose is equal to 1 tablet or 1 or 2 sprays under the tongue. People often have some side effects, and they usually affect about 1 in 100 people. They're less likely to occur if you're using the skin patches, which are for the long-term prevention. It's important to talk to your doctor or pharmacist if any of these side effects are bothersome or last more than a few days. So what might you expect? You could have headaches, feeling dizzy, feeling weak, tired or sleepy, feeling sick, and getting a red flush on your face. So let me just summarise for you. Hopefully you found everything so far interesting. Vasodilators play an essential role in managing and preventing angina, helping to relax and widen your blood vessels, improve blood flow to the heart, and to reduce its workload. It's important to understand the differences between short-acting and long-acting nitrates, and knowing how to use your GTN tablets or spray safely can empower you to manage chest pain effectively and to respond very quickly in an emergency. Always have spares and act fast. Being confident with your medication can help you live well with angina and reduce the anxiety you experience about chest pain episodes. Always follow your doctor's advice, and I can't repeat enough, keep spare medication on hand and be aware of the potential side effects. With careful use and awareness, vasodilators can help you maintain your heart health and live confidently while managing angina. So thank you very much for listening today. If you found this episode helpful, please subscribe and share it with someone you know is living with angina. Just to help out a little bit more, I've also included a link in the article that accompanies this episode on my website. You'll be able to download and print out an angina and heart symptom tracker. It will help you provide the necessary information about your condition and have meaningful conversations with your medical team. So pop over to www.myheartandmind.co.uk/podcast. That's www.myheartandmind.co.uk/podcast. Get your copy today. And remember, you are loved more than you will ever know. You are admired by more people than you'd ever expect. You are worthy of joy and happiness. You are enough. Until next time, take care of your heart and mind. Speak to you soon.
You've been listening to Sally Crawley and the My Heart and Mind podcast, a show for you if you've had a heart attack, cardiac event, or other life-changing experience and want to feel good. It's all about mastering your feelings and emotions so you can feel great and live the life you love. To find out more, visit www.myheartandmind.co.uk and note that that's an AND and not the ampersand character. Go be magnificent.